Hello and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network, and joining us in studio today for return engagement, we haven't talked to in a little bit, Cheryl Bartlett, who's the president and CEO of the New Bedford Community Health Center. As I asked her before, I've always referred to it as Greater New Bedford, and you had a rebranding, and it just slipped my mind. So
probably there were other higher priorities, but yes, a couple of years ago, everybody feels like the name is long, Greater New Bedford Community Health Center.
Well, it makes your business card, your title.
Yes, and every time you talk about the health center, if you go through the whole name, so everybody abbreviated it in their own way. Some people thought we should totally get to contemporary and get rid of New Bedford, but we decided that we would hire a marketing company and do a little rebrand focus groups, and we talked to key community leaders, our patients, our employees, and unanimously we decided New Bedford had to stay, and we just got rid of the Greater and Center on the end, so New Bedford Community Health.
So lots going on, and we want to talk about the organization because you are expanding and growing, which is great. Obviously the need is great. I want to get your thoughts here on a couple of things that we've always talked about here as we look at, as we tape the show here in February of 2025. You've got a flu season that is, according to health experts, and this is national now, could be the worst flu season in 15 years. And it seems to be, according to the latest numbers, growing right now. Are we seeing it here locally?
Yeah, we are seeing a little surge. It seemed like that we definitely had, flu was the worst of the three respiratory diseases. COVID, very minimal. Respiratory syncytial virus, almost non-existent. But a good flu wave, and then it kind of damped down, and then in February we had another surge, and that's across the state and the country, and seeing the same here in Bristol County and the city of New Bedford.
You know what's interesting, that obviously after COVID there's been so much research and talk and, you know, cover your mouth and shaking hands and all that. Is it surprising that you see the flu, or really any illness, like expand like it has? I mean, it's really grown, like you said, over the past month. Yeah,
I think that people are more social than ever. I think the constraints of COVID really, once we got through it, have thrown caution to the wind in many ways. People travel. Very few people wear masks, if you notice, in public and group settings. So, and then in the wintertime when you're indoors, these viruses are much more likely to infect other people, whereas outdoors in our warmer weather, we're easier to gather together in social settings. So not necessarily unsurprising if you look over history. These viruses come and go and have strong years and quiet years. So we're having one of those years.
It's been a later year too, from what I've read, for the flu too. I mean, we were told to get the shots back in the fall, for crying out loud.
Right.
And I know the city had their health fair, and we got, you know, I got my shot back in, I think it was October. How long does flu season usually last? I mean, is this something that could go right through the spring and summer?
Well, it's not atypical to last this long, but you usually see it's sort of the bell curve.
Waning, yeah.
Yeah, you see a few in the fall, so that's why they say get your vaccine early. But the majority of it is the December, January, February. But again, the numbers, I think COVID was so virulent, and now that the virus has, the different variants have settled down to being less virulent than they were, that the flu, which we probably have forgotten that before COVID we had flu seasons that were pretty much up there, maybe 15 years is the worst in comparison, but we definitely have years, and the flu types, which flu virus it is, and the vaccine for it covers many variants. Over the years, Massachusetts has really developed a vaccine to cover 4 or 5 different versions of the flu virus.
And vaccinations, I know, nationwide are down for the flu shots this year. And kind of what you were saying off camera, I mean, it's vaccination fatigue, I guess.
Yeah, I would say definitely COVID, people are totally not interested in the COVID. So comparatively, I think we gave 2,000 COVID vaccines this winter and 8,000 flu vaccines. So flu, because I think we have a longer history with it of getting it every year, people still, for the most part, again, though this year not as many, so I do think people are tired of vaccines and flus and all of the public health preventative measures, which we see in lots of epidemics where people are scared in the beginning, when people get really sick from something, they listen to what they need to do, and then over time we get tired of it. So.
The interesting thing, and you've talked about this in the past, and I think it's good to reiterate too, is the vaccines themselves don't prevent you from getting the illness.
Right.
They just prevent the severity of the illness.
Correct.
And I think people forget that. It's like, well, I got the flu. I mean, I certainly had a cold over the winter.
Right.
I don't know if it was the flu or particularly, but it's not as bad if you get it. That's the whole point of it.
Correct. And it is preventative a certain percent.
Okay. So that, and the other thing too, I think you brought up a good point briefly, but we were all wearing masks not that long ago.
Right.
And now that we aren't, I remember you were telling me you were on a flight a couple of years ago, maybe, I forget what it was, but you were saying that, everybody's got the mask, and
Yeah.
it's not like that anymore.
No. I would say in airports, if I see a handful of people with a mask on, they almost stand out now.
Right. And the interesting thing too is you were saying the numbers were just staggering. 33 million people so far, they estimate, sickened by the flu nationwide. 430,000 hospitalized.
Yeah.
And 19,000 deaths.
Yeah. Yeah, flu can be very serious. We actually got a circular notice from the Department of Public Health last week that children are having a lot of neurological impacts from getting the flu. And so when anything sort of starts to pop up out of the ordinary, the Department of Public Health sends out circular letters kind of informing providers what they're seeing and neurological impacts. And hospitalizations are up. Compared to COVID, less than 1%, being hospitalized at about 9% with flu and sicker.
Would you advise people to still get the flu shot, even right now?
I would say yes.
Okay.
Yes.
It's really not a big, to me it's not a big deal. There's no...
Right. We have another month of winter, and it's around.
Yeah, yeah. And it still takes a couple of weeks to be, immunized.
Get your immunity to respond to it, yep.
So.
And we, again, encourage masks. At the health center, what we're doing is anyone that's symptomatic of a cold or anything, we make them put on masks. And we, in the clinical area, when we see the numbers go up, we make everybody wear masks. So we're still masking sort of based on what we're seeing happening in real time.
Touch on COVID, though. I mean, we've touched on it a little bit. From where you sit right now, because you were on the front lines, you were in here many times talking about COVID, but it is declining. Where do you see that right now? It's not a pandemic anymore, I guess?
Right now.
Or is it? Is it?
Well,
I don't know.
I would say things become at some point what we call endemic,
Correct.
which is there's a normal, or this is what the sort of baseline we're going to see. So then we measure from there. Once we start to see, last year wasn't a terrible year for COVID. It was spikes here and there, predictable around holidays where we know lots of people are gathering. But it's now at a sort of an endemic level that's low. So again, we'll measure it. If next year all of a sudden it's higher than this year, we'll say that it's at an epidemic proportion. It's still around the world, so a pandemic would go to a worldwide impact, but not a pandemic, it's not at that rising, scary level.
But is it surprising, or just historically, when you look at this sort of thing, is this normal that it, I guess, wanes like this?
Yeah, microorganisms, they say, have life cycles where a new variant evolves out of, sort of the biological evolution, and it reproduces itself rapidly, and then it kind of infects its hosts. We're the hosts that get infected by these microorganisms, and then over time they start to go down and wane. So it is kind of a typical life cycle of microorganisms.
Do you expect that the COVID or a COVID vaccine will be given every year? It's the option will be there to get it?
I think so, until it gets to a point that it isn't economically profitable, or I would say that we would most likely see that continue.
One of the things too about the vaccinations that I think is interesting is that I don't know if it's the question of availability, or it seemed during the pandemic you had the opportunity to get a shot at a lot of different places. Now it doesn't seem that simple. I mean, I know you can go to CVS and set up an appointment, but like I know South Coast Hospital doesn't give it out. When I went for my physical, that's not something that they give out.
We do. We have it stocked, and we just give it through regular appointments.
The city used
now.
to have clinics or
Right,
whatever.
right.
They don't do that anymore.
Right. People weren't coming. So now it's really part of your medical appointments.
Mm-hmm.
So we, our typical MO, which probably we're more rigorous since COVID, is to see if people are up to date on vaccines, and if they aren't, we offer them to them. So that's just part of a regular medical appointment now.
I wanted to ask you too, I know it's not an issue here, but I know you keep track of the news and health, but there's a pretty good measles outbreak right now in Texas, which seems, you don't really hear about that. I haven't really heard a lot about it, but there's a good measles outbreak going on right now in Texas, and that just seems kind of, where did this come from?
Yeah, well, again, as vaccinations decline, people start declining all vaccinations. And I think, again, the vaccine fatigue is across the board. I think a lot of younger parents don't vaccinate their kids. And if kids go to school, measles can transmit pretty easily. So the more you have a population less vaccinated, the more risk we are for childhood diseases that were almost really eradicated. Mm-hmm. And I do think there's a mentality in a younger generation that they haven't seen what the impacts of something like measles can be. So parents say, hey, why introduce something into my child that's unnecessary, and I haven't seen anything to make me concerned about this. But measles can be really dangerous to an unborn child.
You were talking about that off camera.
Yeah, and
Interesting.
the disabilities that come if a mother gets measles while she's pregnant is pretty significant.
Because there's no treatment for it, correct?
No. You manage symptoms like you do with most viruses. Most viruses, there isn't anything in particular to treat. Mm-hmm. There are some antivirals, but again, I think the worst thing is that people with measles, not knowing they have measles, particularly because we're not familiar with it, so it might take longer for someone to be diagnosed with measles, and we like to quarantine people with measles, and exposing
the video,
pregnant women.
The video that you see of them getting taken care of, they've got the full hazmat suits on and everything, taking care of the people with measles. That's shocking, really, to see that.
Yeah, I actually haven't seen that, but measles is very easily transmitted. So if they have a large outbreak and are trying to contain it, I can see that. And again, the concern is how far spread this goes in a community. And people unsuspectingly come across someone with measles. And again, protecting pregnant women is a really important part of public health measures.
I don't know the answer to this, but I'm curious as we're talking about this because it came into my head. My kids are older now. Are there still, do you still need a lot of vaccinations, or are there a lot of vaccinations given to kids right now? The options?
Oh, yeah.
Measles, I assume, is one.
Measles, mumps, rubella, all those things. Polio.
So they're still given to kids?
Yes, there's definitely part of within the first 6 months of life, there are a lot of vaccines, and at a year, I believe there are some shots that they continue to get. Some of them are multiple doses to continue that immunity.
And from your standpoint, those are good things to get. They're effective?
Absolutely. I think the two most effective things we've seen that have improved our life expectancy have been vaccinations and what we call community sanitation, which is how we manage food, how we manage our wastewater. Those are the things that really have made us extend our life expectancy. So going back the other way, to me, is bad public health.
All right, now getting into some of the fun thing. I wanted to touch on the health stuff, but I want to talk about, you and I were talking about expansion and growth of the organization, and it has grown. Tell us a little bit about where are you right now as an organization?
Right. So we serve about 25% of the city's population, so I feel like we're a critical provider in the city. And in the city of New Bedford, there are about, other than the providers at the health center, there are four provider practices that provide primary care in New Bedford, so significant work that we do. We also probably are the major provider of people that speak other languages. We have a pretty robust ability to serve people that English is their second language. And we serve a very vulnerable population, a very poor population, and we serve people regardless of their ability to pay. And we can't meet the need of the population. We have wait lists. I heard recently that one of the providers in New Bedford, one of the larger providers, has 4,000 person wait list.
Wow. Is
So
that for basic service or?
for primary care,
Primary care,
having
yeah.
a regular provider available to you, your annual physicals, all those things, and wait lists.
Talk for a second, and this is sort of off the track, but kind of on the track too. The number of family doctors is down.
Right. That's what I'm saying.
Right.
Is we
so
are the
what is-
major provider.
What do you think causes that?
The burden of paperwork that they have, having multiple insurers. Each insurer has different rules for what's covered, what isn't covered. We have things that are called pre-authorizations. If you're going to get certain medication, always in the name of controlling costs, you have to get it approved by the insurer. So we have a full administrative team that has to try to manage the care, and a lot of that burden falls on the primary care provider. So they go into medicine to take care of people.
Right.
And they're spending their day checking boxes. Did I do that? Did I call this one? Did I get that approval?
Do you find that there are less people going to medical school?
Yeah, less going into primary care, not into medical school in general. Everyone's becoming a specialist because you don't have that burden. You're not managing the day-to-day care of somebody. You see them once. You have an orthopedic issue, I look, you got a broken bone, I treat your broken bone, you go back to primary care.
Wow, okay.
Primary care doctors have to, when you get home health services, every 60 days you have to fill out an 11-page form. Primary care has to do that. Anybody that goes on a family medical leave, whether the issue was related to a primary care issue or say you had an operation and you're going to go out on family medical leave, the doctor that does the operation doesn't have to fill the paperwork out. Your primary care does.
Wow.
So now they have to track you down, bring you in, get the information, fill out the form. So there are all these things that is falling on the burden of primary care. And one of the things that is helpful is at the health center, we have a team.
Right.
So we try to take as much of that administrative burden off the provider so they can do the care and do what they went into school to do.
Yeah.
Very frustrating for them. It's never ending. You have to know how to code. Every single visit, you code it in a certain way.
Put on your old hat for me when you work for the Commonwealth. Is this something the state needs to address?
Yes, the nation needs to address it.
The nation needs to address.
And as a matter of fact, a former colleague of mine, the Commissioner of Public Health in Rhode Island, when I was Commissioner of Massachusetts, Dr. Michael Fine, has formed an organization he calls Primary Care for All Americans. And he's trying to rebel rouse across the country in every state and trying to get it down to a community level of where we have to really beat the drum and say we have to change this. The payment system is got a perverse reward system. We pay specialists way more than we pay primary care. So if you go to medical school and come out with a couple $100,000 worth of debt, and you can make $500,000 or you can make $200,000, and you have all that administrative burden, everybody's becoming a specialist.
The one thing, I talked to a couple of medical students in the family over Thanksgiving last year, and they were interesting. They talked about that. But the one thing they both said, they wanted to really talk to people, meet people, spend time with people. But financially, it's not beneficial. They would like to get to know people and see families grow. But that's really not an option if you want to make money. If
you want to survive, basically, right? So they can sometimes, I think the target standard in the industry is to see like 24 people in an 8-hour day. Then you have to do notes, you have to order the medications, you have to order diagnostic. You think about what a treadmill that is. And so most places 15 minutes is your max, so try to get all the things in you need to do with that patient in 15 minutes and do the paperwork is nearly an impossible task. We have it down to 20-minute visits. I'd ideally like to make them half-hour visits, but I can't get paid. The system, even though we've moved into what they call accountable care and value-based care, where they're saying, we're going to give you a capitated amount of money per patient per year, and you figure out how to improve their health. I actually like that, because then I can be innovative with the team and figure out, well, where do we have, what skills do we need doing what things to help take care of the whole patient. But they give us a capitated payment and say, go to town and do it, but at the same time they measure how many visits I have. So if I don't have enough visits, then I get dinged financially. So it's kind of like I'm in two different systems.
Damned if you do and damned if you don't, really,
But to me, a half-an-hour visit would give the provider time to have that relationship, give the nurse and the medical assistant time to prep them for the visit, do any of the follow-up discharge work that needs to be done. And the system is really, really broken. So we formed a group actually in New Bedford called Primary Care for All, and there are about 40 of us that are meeting every 2 weeks, and we're just talking about, is there something we can do on a local level in the short term while we work collectively with hopefully a group of people that have a growing movement to say enough.
Talk about the projects. We got about 6 minutes left here. The projects that are going on right now. You've got some things moving ahead, and you were talking about this the last time you were on, about them. Where do we stand with those?
So the silver lining in COVID was I was able to raise a lot of money, and I was able to put a lot of my operations onto COVID money. I was able to collect a reserve of money, and I bought 3 buildings during the coming out of COVID. I bought the former charter school, which is an administrative building. Now I'm basically creating a campus and own almost the whole block downtown. We bought Rite Aid out of bankruptcy in May. We bought the Bamboo Garden restaurant, which actually is...
so you can get dinner.
You can get dinner. I'm going to retire and run the restaurant.
And have the Chinese,
No, we're turning that into a behavioral health center, which I'm very excited about. So we'll have substance abuse treatment providers, we'll have community health workers, recovery coaches, we have psychiatric nurse practitioners that can manage people's mental health concerns. And so we just got all of our approvals, long time coming, and we got a $2 million congressional earmark that hopefully is still around that we can pay for this remodel, and I hope to, by the end of this year, have a beautiful new center. And then I'm about to kick off a campaign for $5 million to raise private money in order to try to remodel Rite Aid and add 30 exam rooms to increase efficiency for providers, be able to hire a couple of new primary care providers.
Well, you are, I saw you're looking for some medical, different professionals right now. You're looking for a senior medical director.
Yes, we are.
Those seem to be, that's an important position.
Yes, it is, because it's more and more primary care is being provided by nurse practitioners and physician's assistants, and they are well trained, but not as trained as a physician is.
Right.
And so in Massachusetts, a nurse practitioner has to work under the license of a physician for the first 2 years of practice, and physician assistants always work under the license. So we always need physicians for preceptorship, mentorship, training, and hiring them is a challenge. But we have an incredible chief medical officer who a lot of burden is falling on her in order to manage all these requirements in medicine.
With these additions, and you've talked about them, so they've been in the works for a while now, are you satisfied, or do you think that will be, I don't want to say enough, but obviously the need is there, or you wouldn't have done it.
Right.
Is that enough for you right now as far as what your vision of the amount of people that you're seeing on a regular basis? Will this help alleviate what's going on?
Yes, it will. And we also have a couple other things in the works. We're going to open a school-based health center on the high school property, which will be a standalone facility that will not only serve students, faculty, staff, can serve anybody in the community. It will be a satellite of the health center. So our hope is some of the folks that live in that neighborhood might come and get their services there. And we're working with CEDC, and they're rehabbing the old Capitol Theater and creating a multi-service center that we hope to have a small primary care practice there. So I feel like that in the next 3 years, if all those things happen, and at least 2 of them I know are going to happen, I think that we'll be in good shape. Also working with Hawthorne and South Coast to try to encourage them to open some practices in the actual city of New Bedford. A lot of their practices are in Dartmouth and Fairhaven, and transportation's a problem for a good part of the population that lives in New Bedford.
Yeah, absolutely. It's definitely an issue. I would think that too, that in a sense, during your tenure here, and you and I have talked for a while now, sort of the, I don't want to say the image or the health center's changed, or the organization's changed. You've got a different sort of format now when you really look at it. You're getting out into the community more than... Yes, nobody knew who we were when I got here. I was blown away by that, and I'm, as you know, very much an outreach and get out in the community, meet the community leaders, collaborate with all the other not-for-profits in the community. So I would say COVID, we were a major provider of vaccines and testing during COVID. So if people didn't know about us before COVID, they certainly did, because we were the place to go. We got to leave it there. This has gone by very quick.
Yes.
We will chat again for sure. I know, hope to be at the ribbon cuttings or groundbreakings or whatever we're doing. Let us know. That would be
hoping
great.
to get the governor down to see Rite Aid, because I'm trying to get $1.7 million from the state legislature.
You're always working there. It's good seeing you.
You too.
That's going to do it for this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network. Thanks for watching, and we'll talk to you again soon.
Hey, Mason.
Hey, Mason.
Thank you.
A place to make my own, a place that I call home, this place that I call home.